This is Ashley Gerard, and I am recording my student assessment video number 1. Alright, I'm going to start my assessment by looking at the skin of the upper extremities. I'm looking at the color, temperature, texture and condition of the skin, checking the skin turgor for hydration status, as well as looking for any lesions that might be present. I'll move on then to the skin of the lower extremities, looking at color, temperature, condition and texture of the skin, checking skin turgor for hydration status, as well as for looking at any lesions that might be present. With the lower extremities, I will also be looking at the hair distribution, looking for any varicosities that might be present, as well as testing for the presence of edema. I'll then move on to the nails. With the nails, I'm looking at the color, as well as capillary refill. In the nail, I'm looking at the condition of the nail, its texture, firmness, and thickness. I'll also be looking at the contour of the nail, looking for any clubbing that might be present, as well as its adherence to the nail bed. I'll then move on to the head, face, and scalp, and I'll be inspecting and palpating the head, face, and scalp. When looking at the head, I'm looking at its general size, shape, symmetry. I will inspect the scalp, looking at the general condition of the hair, its quality and texture. I will palpate the paranasal sinuses. I will also palpate the temporomandibular joint, and I'm looking for movement, click, or crepitus. Additionally, I will be testing the function of 2 cranial nerves. The first is cranial nerve number 5, the trigeminal nerve, and that innervates lateral movement of the jaw clench, as well as sensation. Can you feel? I will also be, and the second nerve would be cranial nerve number 7, the facial nerve, and I'll test that by having you smile, frown, bare your teeth, puff out your cheeks, and purse your lips. Okay, great. I'll now move on to looking at the eyes. First, we'll talk about cranial nerve number 2, the optic nerve. And there are a couple of tests that are used to evaluate that, and we'll just discuss them quickly. The first is the Snellen test for distance vision. And this chart would normally be much larger. I just have this for illustration. And it would be held 20 feet away from the patient. And the lowest line the patient could read without assistance would determine the visual acuity for distance. On the other side, I have here the Rosenbaum test for near vision. It's similar to the Snellen in that, but it's held much closer to the patient, about 15 to 20 inches. And once again, the smallest line that can be read by the patient unassisted would determine the near vision. I'll also test your peripheral vision by doing something called the confrontation test. So I'm going to hold this out to the sides of your peripheral vision, and just let me know when you can see it while looking straight forward at me. Just say now.
No. No.
Very good. Okay. And so now we'll move on to the cranial nerves that innervate movement of the eye, and that's cranial nerve number 3, oculomotor, cranial nerve number 4, trochlear, and cranial nerve number 6, abducens. And I'll do that by looking at the 6 cardinal positions of gaze. So if you could just focus on the tip of this pen light, don't move your head, just follow the movement with your eyes. Okay, very good. I'll also be looking at the corneal light reflex, which is good. And now I'll move on, to looking at the external features of the eye. And so I'll be looking, oh, I'm sorry, I forgot to do the cover-uncover test when looking at the eye. I'm just going to cover your eye. I'm going to cover one eye and look for any movement in the other eye, which there shouldn't be any of. Okay, and now I'll move on to the external features of the eye. So I'm looking at the eyebrows and eyelashes, looking at the cerebral fissure. I'm looking for lid lag and symmetry. I'll also be looking at the external features of the eye itself, the iris, cornea, conjunctiva, sclera, the lid, the lacrimal apparatus, anterior chamber, and position of the globe. I'll then be looking at pupillary response to light, and I'm looking at both direct and consensual light, as well as if you could focus on a point Don't move your eyes. Focus on a point behind me and then look at my face. Okay, very good. And I'm also going to palpate the lacrimal sac. Okay, so now I'm going to move on to using my ophthalmoscope. The first thing I'm going to be doing, to get very close to you, I'm looking at lens clarity and red reflex. I'm also looking at the optic disc, its size, shape, color, physiologic cup and margins. I'm also looking at the retinal vessels, and for the retinal vessels I will be looking at the color as well as the AV ratio and the atriovenous crossing characteristics. And finally, I'm looking at the retinal background, and I'm looking at color, the presence of hemorrhage or exudate. I'm also looking at the macula, fovea, and centralis, looking at color and regularity. Okay. I'm now going to quickly pan the camera around the room to ensure that no study aids have been used. Okay. I am now going to move on to my assessment of the ears. Actually, you know what? To go back to, oh wait, no, okay. So for the ears, I'm going to be doing the Weber and Rhine test. And so for the first one, I'm going to put this on the center of your head. I need you to let me know when you stop hearing it.
Okay.
I'm also going to conduct the Rhine test. I'm going to put this against your mastoid process. I need you to tell me when you stop feeling it, and then I'll put it to your ear in the air and tell me when you stop feeling that.
Okay. Okay. Okay.
Okay. I'm also going to perform the whisper test. I'm going to whisper 3 words in your ear, and I need you to repeat them back to me.
Boat, red, Canada. Blanket, orange, lamp.
Okay. And then I'm going to get my otoscope, and I'm going to be looking at the ear. I'm looking at the auricle and mastoid. I'm going to use the otoscope to look at the meatus and the ear canal. I'm also going to be looking at the tympanic membrane and for the cone of light reflex. And I'll also be looking at the umbo, malleus, and pars tensa and pars flaccida. And I'm going to pull the pinna up and back. Okay. And hearing is innervated by the acoustic nerve, which is cranial nerve number 7. Okay. I'm now going to move on to looking at the nose. And so I'm looking at the size, shape, symmetry of the nose. I'm going to be inspecting the mucosa, the septum, mucosa, and turbinates. I'm going to determine patency of each nostril. If you could occlude each nostril and breathe. Okay. And I'm also going to be testing olfaction, which is innervated by cranial nerve number 1, the olfactory nerve. If you could identify this for me.
Close.
Very good. Okay. I'm now going to move on to the mouth, and I'm looking at the lips. If you could open your mouth. I'm looking at the teeth, gums. Could you open your mouth? Buccal mucosa, and lift up your tongue, the sublingual area. I'm also going to be looking at, you don't have to keep lifting your tongue, just open your mouth. I'm also going to be looking at the frenulum and the Simpson's and Wharton's ducts. I'll be looking at the tongue and uvula. If you could stick out your tongue and say ah. As he says ah, I'm making sure that the uvula remains midline. And that is innervated by the glossopharyngeal nerve, which is cranial nerve number 9, as well as the vagus nerve, which is cranial nerve number 10. We're not going to demonstrate this, but that nerve also innervates speaking, swallowing, and the gag reflex. If you could one more time open your mouth and just move your tongue from left to right and up and down. I'm looking at tongue movement, which is innervated by cranial nerve number 12, the hypoglossal nerve. And then finally, I'm going to move on to the neck. I'm looking at the symmetry of the neck. I'm going to, let's see, I'm going to palpate the cervical spinous processes, as well as the paravertebral muscles. I'm going to test range of motion of the neck. If you could move your neck from side to side like this, up and down, okay? I'm also going to be testing the function of the spinal accessory nerve, which is cranial nerve number 11, and I'm going to do that by having you shrug your shoulders against my resistance, okay? And then move your head from side to side while I try to, no, from like this. Okay, very good. I'm also going to palpate the trachea for symmetry and position. I'm also going to palpate the pre and post auricular, submental, sublingual, and submandibular nodes, as well as the anterior, deep, and posterior cervical chains and the occipital nodes. Okay. I'm also going to inspect, palpate, and auscultate the carotid artery. Okay. And I am also, if you could swallow for me. Okay. I'm also going to inspect, palpate, and auscultate the thyroid. And I'm listening for any bruits or other abnormal sounds. Okay? And that concludes my assessment of the upper body. Thank you.